Hello, my name is Hiram Nelson, and I'm the entrepreneurial lead of the Quadrisense team, number 62. I'm here with Chris Ross, my business mentor, and Dr. Shakar Benzali. So the Quadrisense team was originally hoping to make a diagnostic device for lymphedema or lipedema. Our initial assumptions were that physicians and surgeons would be very ecstatic about using our product. We believe that the main value that we would bring to them is that they can classify patients, refer them out, and possibly even diagnose and differentiate between the two diseases. These, of course, were our assumptions for the clinical market. However, what about a personal market? What if we could use our device as a hydration sensor for athletes and military personnel and anybody else who really pushes their body to limit? In order to validate and test our customer segments and value propositions, we went out to a conference for lymphedema in Phoenix, Arizona. We decided to ask physicians and surgeons what they thought of the technology, and they ended up saying that they don't need it because they already have a diagnostic tool. But we did find out that we could pivot and make this a monitoring device for the physical and occupational therapists that were present. Their biggest pains were trying to monitor the disease progression for lipedema and lymphedema patients, and this would be a real great niche for our market. To validate our next customer segment, we went to gyms and athletic events and really tried to talk to the casual athlete versus the uber athlete. What we discovered was that the casual athlete really didn't care about the technology, but the uber athlete, on the other hand, really wanted to monitor his hydration, his electrolytes, and something new called rhabdomyolysis. This was a major pivot point for our device. As a happy coincidence, we also found that as a hydration sensor, the DoD and the military may be very interested in our device to monitor their physical training teams, like the PJOC, the Marines, during all of their exercises. Now that we're towards the end of the I-Corps program, we find out that there's still quite a bit of discovery we need to do. We so far have 3 customer segments: the therapist customer segment, the military, and the personal athlete device. So we still need to find out which market is the best to penetrate first to generate the most revenue as a startup company.